Welcome to Soundblatt, the podcast of the International Society of the Rorschach. We have today the great pleasure and the honor to have with us Dr. Stephen Finn, who is the founder of the Center for Therapeutic Assessment in Austin, Texas, USA. He's a clinical associate professor of psychology at the University of Texas at Austin, senior researcher and director of training at the European Center of Therapeutic Assessment at Catholic University of Milan, Italy, and director of training at the Asian Pacific Center for Therapeutic Assessment in Tokyo, Japan. He has published more than 90 articles and chapters on psychological assessment, psychodiagnosis, and other topics in clinical psychology. He is the co-author of two recent books, Therapeutic Assessment with Adults and Therapeutic Assessments with Children. Among other awards, in 2011, he received the Bruno Clofer Award from the Society for Personality Assessment for distinguished lifetime contributions to personality assessments, and the Carl Rogers Award in 2018 for an outstanding contribution to the theory and practice of humanistic psychology from the Society for Humanistic Psychology, Division 32 of the American Psychological Association. Thank you so much to giving this time to have the opportunity to talk with you and know more about your work. Tell me,
thank you,
Stephen,
Fernando. Thank you so much. So it's a pleasure to be here. So, yeah.
I would like to start from the beginning. Tell me about how you decided to start studying psychology and at what moment, in which point of your studies you knew about the Rorschach and became interested in studying it.
Thank you. Yes. It's a very interesting story because initially I had no plans to be a clinician at all. I went to the University of Minnesota as a graduate student to study clinical psychology, but I saw myself being more of a statistician and researcher. I was very good at mathematics. I liked research, and but as I chose clinical psychology because it was the most prestigious area of psychology at the time, and I thought it would be good for me to have a specialization there. And of course, as part of my training, I had to start learning psychological assessment and psychotherapy. I was very fortunate in my first year at University of Minnesota that a woman named Nancy Rains taught our Rorschach course. She wasn't a regular faculty member. They had brought her in to teach it. And she had become quite proficient in John Exner's comprehensive system. And she taught it to us. And I started to be very interested by the Rorschach. Then that summer, after my first year in graduate school, I did my first clinical practicum at a psychiatric hospital in Minneapolis. And I had and the senior psychologists there were wonderful Rorschachers. I mean, and wonderful sort of interpersonally trained psychologists. They several of them had connections to people who had studied with Harry Stack Sullivan, and they taught me the Rorschach, and I had an amazing experience that summer with the Rorschach that just impressed me so much. It was a psychotic man that I had been assigned to give the Rorschach to, and he rejected cards 8, 9, and 10 of the Rorschach and refused to give any responses. And he said he couldn't see anything in those ugly cards. And this was a man who was very well known in the hospital. He would appear in the emergency room of the hospital every 6 months or so, psychotic. They would admit him to the inpatient ward, get him stabilized on medication, send him out and ask him to participate in the outpatient program, which he would never do. And then 6 months later, he would end up again in the hospital. And so I remember giving this Rorschach. He rejected these cards. I thought I had failed my first Rorschach. And I went to my supervisor and said, "Oh, I'm very sorry, you know." And it was a wonderful supervisor named Ken Hampton. And he said, "No, you didn't fail." He said, "We learned something so important." And I said, what? And he said, well, what do you know about cards 8, 9, and 10? And I said, well, I don't know. I guess I've heard about this color shock phenomenon. And he said, yeah, they stir up emotion. And what does it tell us that this man refused to give responses and said they're ugly and go away? I said, well, I guess he was like avoiding getting into things. And he said, yes. And so that's why this man we know him well. He has a lot of trauma in the past. He won't ever deal with it. He goes away, and because he hasn't dealt with it, he ends up back in the hospital again. And here's a perfect example of it showing up on the test. And I said, oh gosh, I get it. I really understand. Now what do I do? And he said, you go back and you tell him that. And I said, what? And I did my first Rorschach feedback session, and I said, I think there's painful things in your past, and you don't want to deal with them, and I can understand because they're so painful, but then you avoid it. And the man said, oh my God, this is the most helpful thing that's ever happened to me.
Wonderful, wonderful story.
And then
wonderful story.
He didn't show up. He left the hospital, didn't show up 6 months later in the hospital.
Oh. Wonderful.
A year later, he ended up in the hospital. I was in another practicum at that point, outpatient service, and they sent me a message that this patient was asking for me and to please come to I entered the locked ward. He came up and shook my hand and said, can we do that ink blot test again? It was the most helpful thing that's ever happened to me. And at that moment, I fell in love with the Rorschach.
I see. You had a very strong training in psychotherapy, I think, isn't it?
Yes, I've studied many different forms of psychotherapy in depth. And I think that's helped me with psychological assessment also, and helped me begin to see, from this experience, you can see an assessment can have therapeutic power. And so I started experimenting how you could do that using the Rorschach.
Tell us about the way you started doing research and some kind of experimentation between psychotherapy and Rorschach. In which way you started that path that has been so successful worldwide?
Well, literally after this one experience and several others in my training, I got the idea that assessment could be therapeutic as well as being used for diagnosis, treatment planning, all the good things that we do with that. And I started talking to my professors and looking in the literature to see if anyone had explored this or researched it. And there wasn't a lot there. And so in 1984, I got my PhD and I went to University of Texas as a professor there. And I decided to make this my research program to see whether assessment could be used as a sort of brief therapy. Initially, I was very focused on the feedback session and how giving feedback could help people understand themselves better and learn things about themselves. But gradually, I started looking at other parts of the assessment process too. For example, one of the things I discovered was if you asked people at the beginning of an assessment, what do you want to learn about yourself? Do you have any puzzles or things you've been struggling with for a long time that you haven't been able to figure out that we might be able to use the assessment with? And could we get that in the form of like a question you want to have answered? I found that if you did that, it was much easier to give feedback at the end. And people were more cooperative and open during the testing process because they wanted the answer to their question. Then the next thing I discovered, I happened upon the work of Constance Fisher, who had already begun to develop this procedure called collaborative psychological assessment. And she would involve the client in looking at their test report and discussing their test responses. And I started learning that you could do that and it would have therapeutic benefits. So now I give a standardized administration of the Rorschach so that I can score it and use the codes, and I very much like that. But after I give the Rorschach, I pull my chair around and I say, so what was that like for you? And the person will say something, and then I'll say, could we look at your responses? And, sometimes, I'm going to score them and I'll tell you about the research, whatever. But sometimes there are things that come through in the responses that are almost like metaphors for people's experience. Let's look through your responses and see if that captures anything. So on card 3, I noticed you said 2 people struggling and pulling apart this basket in the middle, and they're fighting, and each one is trying to get it. Anything come to mind? And the person says, oh, my parents' divorce. Oh, tell me about that. Oh, it was terrible, and I was caught in the middle, and I felt whatever. And then I say, could that have anything to do with the question you gave at the beginning about why you're having trouble getting into romantic relationships? And it opens up windows that otherwise might never get opened.
Wonderful. I see. Many people praise the way you work, the ideas you have, with the way to get access to the unconscious of your clients. And I believe that you have, at least I ask you, certainly you design some kind of strategy working with the responses and the way to work with the client to find a gate to their problems and symptomatology. Why don't you tell us more about that? The way you have been, we already know the way you started, but in which way you managed to develop more strategies in the relationship with the client and the way to treat their problems?
Yeah, when I was studying feedback, which was my initial focus, I really became very curious about something I think all assessors have experienced, that sometimes our tests give us very useful information that could be helpful to the person, but the person isn't ready to hear it. And it would be too threatening to acknowledge that information, and it would cause them anxiety and almost in some cases get them to fall apart, And then at the same time, I was studying other forms of psychotherapy that really have to do with look at how therapy helps people change their narratives about themselves. And I came to a belief that all of us in our life develop a story about ourselves in the world based on our life experiences. And what happens is many people develop stories growing up that were very useful then and protected them and helped them survive, but which are not so useful later in life and really are not accurate anymore. Like that marriage always involves a terrible fight between people trying to compete and rip each other apart, and then it gets hard to have a romantic relationship if you believe that. So what I realized is it's very hard to change people's stories about themselves. We hang on to them because they make sense of the world and they're works of art that we've created based on our life experiences. And if you want to help somebody change their story about themselves, you have to be fairly strategic about it. And in a feedback session, for example, it turns out if you want to give somebody information that might be threatening, the very first thing you should tell them in an assessment feedback session is something they already know about themselves and that's congruent with their existing story. And then they go, oh, yes, that's right. And, oh, give me some examples, whatever. Then you tell them things that are a little bit different from how they already think about themselves, but which don't create too much anxiety. And we did research on giving feedback and how you order information. And we found out this is the way to have the most therapeutic impact. And then after that, and it's sort of like reframing how the person thinks about themselves, but it doesn't, they're willing to take in the information and it's quite useful. And then at the end, after that, you can give them information that might be more difficult. Be ready to let them reject it if they need to, but present it to them. And at that point, many people will take in information. And now back to Rorschach. What I love about Rorschach is in my outpatient clinic where I work in Austin, Texas, we get many well-functioning people. You know, they have a lot of money, they have good jobs, but they have problems in living that they have not been able to solve, and they're a mystery to themselves. I like giving them a self-report test because it tells me that initial information of what they already know about themselves. But the Rorschach gives us the information that they haven't themselves been able to grasp. And I'm able, in a very attuned way, to begin presenting that information and using my discussions of their responses, et cetera, to help them begin to take it in. And if you can change somebody's story about themselves in a brief period of time, they go out into the world and they head in different directions and they act in different ways. You know, we screen in information to confirm our existing stories. If you get the story changed a little bit, they start to see the world a little bit differently. And there's this unfolding process that happens. We found the biggest effects of a psychological assessment are not right after the assessment finishes, but 2 or 3 months. The person continues to grow and change.
Wonderful.
Because they have this new lens that they're using to look at the world. And we've been helpful in changing the lens. So
wonderful. When you say I started studying different approaches on psychotherapy, other theories, I would like to know which lines and authors have been important for you.
Yes, thank you very much. My initial training in graduate school was in cognitive behavioral therapy. And I still think there's some very useful tools there. And it too has this idea that we're trying to change people's schemas inside about how they see the world. But I had the fortune to study psychodynamic psychotherapy, particularly self-psychology by Kohut. And this really helped me begin to understand how to be with people in a curious and patient way, and how to listen very carefully, sort of in between the lines, and how to affirm people in very subtle ways. I also did some training in Gestalt therapy that's been very helpful to me. Occasionally, I'll use techniques from that, you know. And then I did a lot of training in child and family therapy also. And this has been helpful because we use assessments not just with individual adults, but we use therapeutic assessment with children and families. There, we're trying to change the parent's story about the child, you know, and think systemically about what's going on and why the parent needs to see the child in a somewhat distorted way instead of having true empathy for the child and what's going on. And so putting these all together has been very useful. And now they're just integrated in the way I do things. So, yeah.
I see. I would like to know which variables of the Rorschach you look the first. I mean, when you see a Rorschach, which point you prefer to start with when you work with your clients?
Yeah. I think the Rorschach is so good at showing how people function in unstructured, emotionally arousing interpersonal situations that normally I'll give a self-report test like the MMPI first, and I get that picture. And that's a very structured situation. The person has a lot of control over how they're presenting themselves. And when I look at the Rorschach, I start comparing the two in my head. Like, oh, this person didn't look very depressed on the MMPI, but look, there's so many morbid responses. Or this person looks pretty well put together, but they have a lot of minus form quality responses. And I pay a lot of attention to how people handle affect in the Rorschach. So is there a high lambda or high form percent if you're using RPAS? What does the CF plus C to FC look like? Do they give many more responses to the last 3 cards? Is the form quality drop on the last 3 cards compared to the other cards? This begins to help me understand what in what context people function in different ways. I think all of us, have different parts of self that emerge in different situations. And many of the people who come to see me do pretty well in structured situations, but have a lot of trouble in interpersonal, emotionally arousing situations. So I particularly pay attention to how the Rorschach opens that up. So
I see. And you have worked with a test-retest, I believe, isn't it?
yeah. Sometimes I'll see people in therapy and repeat the Rorschach and other tests, over a long period of time. And again, not only does it help us see the progress of the patient and how the person is changing, but you can discuss the responses with the person and
Yeah.
help them begin to understand what's going on. And you can use the testing to open up things that haven't yet been discussed about. So, yeah.
When you work the Rorschach with the clients, you work on the content of responses. I mean, you share interpretation on the contents of the responses, or you took some kind of more formal data, trying to introduce that with them. How
It
do
depends. I
you
use
manage
both
that?
at once. So, first of all, I give the standardized administration so I can score it and not worry about it. And if it's a person I know is going to be retested frequently, then I'm very careful in my discussions not to influence future testing. So, but the people
I
I
see.
see, but yeah, sometimes it might be a structural variable. So, like, I remember a man whose question was, why don't I get close to my emotions and what would happen if I did? And I gave the Rorschach, and he was giving 2-3 responses to cards 1 through 7. He got to cards 8, 9, 10, and he only gave one response. And then afterwards I said, oh, so how was it for you? And he said, oh, it was pretty good, except I didn't like those ones at the end. In fact, I think I gave fewer responses. And I said, oh, yeah, let's look. Oh, yeah, you gave 3, 3, 4, only one to each of those cards. Why? And he said, I don't really know. I guess they maybe something about emotion, like I told you, I don't do emotion. And I said, oh, that's very interesting, because there's this variable where we measure the number of responses to those cards and the other. And, the way yours would look, it's kind of like you're a person who avoids emotion. And he said, yeah, that, like my question, right? And I said, exactly. And I said, you want to do an experiment? And he said, what? I said, how about I give you those cards back and you force yourself to tell me more responses? Let's see what happens. I know it was uncomfortable for you and you just kind of put them away. And he said, okay, I'll try. I gave him back the cards and he told the most awful, traumatic responses to those last 3 cards.
Oh, wonderful, incredible,
And then we
outstanding. Yeah.
stopped, and I said, what was that like? He said, oh, I saw such horrible stuff. I said, I know, I was really feeling for you. What do you make about that? And he said, I don't like to think about it, but I had some really awful things happen in my family early on, and I've just kind of put it away. And I said, yeah, but maybe you threw the baby out with the bathwater, And
Yeah.
it opened everything up.
Oh, incredible. Wonderful story again. And tell me, among your interest in affects, you have been interested in shame, and you started from some time until now. You have been working on shames, and you have been studying. How did you come to be interested in shame as a model of affect? Or why did you choose shame for that?
I'll be very open here, which is I realized I had a lot of shame, and
All of
so,
us.
yeah, a lot of shame that it was one of my major issues. And, then I did what Stephen Finn does. I started studying every article and book I could ever find about shame to
Oh,
learn about it intellectually. And then
yeah,
as I started to study it, I started to see it in my patients and see how central it is for so
yeah,
many problems. And then I was already doing the work on therapeutic assessment, and I realized how often what changes people's lives after an assessment is we're able to give them a more compassionate understanding about why they struggle. And if you
Yeah.
have an eating disorder or a sexual addiction or a depression or a psychosis, and you're ashamed about that problem, and if I can help give you a new story about why you have that problem and how it isn't just based on you and it's based on things that happened to you and what happened, that problem will start to change just by your not being so ashamed about it. And so I got very interested in this with assessment. And then I started realizing there were ways I was interacting with people around shameful things that would come. Assessment is very good because it'll kick up things that people have never told anybody because they're too ashamed about them. And they start talking to you about them. And then how should you respond in a way that helps somebody at that moment? And, I think many of us are trained, especially people are trained more psychodynamically and more removed. If a patient says to you, oh, I'm going to tell you something I've never told anybody, and you're going to think I'm a terrible person, and then they tell you, and if you just go, you've confirmed that that person is an awful person. But if you give some other kind of response that helps them at that moment, they begin to be helped tremendously. So,
Yeah.
Yeah.
You should write on that point.
Yeah.
I propose you to write on that point because it's a important difference with other schools of psychotherapy. And tell me, after shame, what's the next affect you are going to work or you would be interested to work on?
Well, from shame, I went to disgust, which is a very interesting affect, and so I've been learning a lot about disgust and how to work with patients who disgust us, because therapists sometimes has that experience. So,
yeah.
And disgust is a very interesting emotion. It's an emotion to expel things and get away from things that might be toxic, So if we taste something and it's spoiled, we spit it out and then we're disgusted of that. And when we're disgusted of other people, my theory is that we see something in them that feels dangerous or that we have to get away from because if we got close to that, we couldn't handle it and it would be bad for us. And so, to be a little Jungian, if you're disgusted with a patient, then probably they represent part of your shadow,
Certainly.
Something in you that you have rejected in you and have not integrated. And once you get that idea, then you can begin to figure out how to work with those people, I think. So, yeah.
Jung has been important in the theories you have studied. Do you like Jungian approaches or not?
A little bit.
Especially.
I think that way sometimes. I'm not that well trained in it, so yeah. And regarding emotion, I adore the psychologist Sylvan Tompkins, who wrote many theory of many emotions. That's right.
Oh,
and lately, I've been very interested in interpersonal neurobiology and how we can use insights from that to help us as therapists. And so I've studied Alan Shore and Daniel Siegel and people who write in that area, and been very interested in the neurobiological research on the Rorschach. What happens when we look at the Rorschach? What happens in our brain when we look at the Rorschach?
Yeah.
So I think it teaches
there
us.
are very interesting research now on that.
Yeah.
And tell me, I would like to know, coming back to Rorschach, which is the feature that you like the most of the Rorschach test? If we can say in that way, why do you prefer Rorschach on any other test, even if you use many other ones as all of us? But which is the feature that you like the most?
I adore the Rorschach because it gives me and the client information about themselves that's almost impossible to discover in another way, and which can then be given back to the person and help them understand problems that they're struggling with. And I use many other tests, but the Rorschach almost never fails me in giving me some essential piece of information about the client that's going to be useful in helping them.
Yeah, it's wonderful. You know, in one of the first letters written by Hermann Rorschach after the publication of Psychodiagnostics, he says exactly the same thing. I'm astonished to see that I can discover completely new things that I have never been able to see in the interview with the patient. So it's a surprise Hermann Rorschach himself and all of us after him. And tell me, I would like to know, among all of your research, all the research that you have done, which are the one that you preferred or that is still lasting in your mind, and that you think that is something else that you'd like to continue working on there?
Good question. Um, you know, what pops to mind right now is just this research on how to give information to people so that they can take it
Yeah,
in. And I think it was a very simple idea. It turned out we researched it well. It turned out, and to me, it makes a lot of sense. And I think every psychologist could learn that little trick about how to talk to people about, it's an old psychodynamic idea about not making premature interpretations, right? Yeah. But
yeah,
but about how to look at test data, figure out if something shows up on the MMPI and the Rorschach, it's more likely to be already in the person's narrative. If it doesn't show up on a self-report and on the Rorschach, then you've got something that's more unconscious for the person. And so you have to first get them feeling safe and confirm their identity, and then you can bring in new ideas. And I just think if everybody could learn that, we would all be working better in psychotherapy and in psychological assessment with our clients. So.
certainly, yeah, yeah. And how do you see? I don't know if I can ask you this idea, but how do you see the future, the presence and the future of the Rorschach? What did you, in which way do you think the Rorschach will develop in the next years?
I'm a little worried because in the United States, many graduate programs in psychology are no longer teaching the Rorschach. And so that concerns me. So I think in the US, Rorschach is becoming more of a postgraduate study. But again, this is my bias, but I think to convince psychologists that the Rorschach is important, we have to show how it can be therapeutic, not just help us diagnose the patient or plan treatment, but how it can have an impact on the person. So
Yeah,
I'm putting all my energy right now in trying to help people understand those therapeutic uses of the Rorschach. And then I think, I tell graduate students at University of Texas, it's one of the sexiest things you can do that's going to help people in the biggest way to learn how to do
yeah,
that. And I show them tapes of me doing it, and then they say, I want to learn the Rorschach, whereas before they don't want to. So I just think we have to keep talking about the utility of it.
yeah.
And it's not just about reaching some understanding. It's how you can then use that understanding to help clients and the important people in their lives, therapists, teachers, bosses, family members, etc. So, yeah.
Very interesting idea. I agree completely with you, Stephen. Well, thank you so much for this time. I would like to have some kind of final thoughts of any kind of idea that you would like to express in this podcast that hopefully people will listen in the future.
I think I'll just
You have,
reiterate what I just said. Don't underestimate the therapeutic power of our psychological assessment tools, and particularly our projective tests, and particularly the Rorschach. They are powerful, powerful tools that we can use to help change people's lives. Our research should be focused on this more. Our clinical focus should be on this. And I don't downplay anybody working on the other aspects of the Rorschach, but I think if the Rorschach is going to survive, it's because we recognize this.
wonderful. Thank you so much for this thought, Stephen. Thank you so much. It's not my
One last
idea.
thing,
Is something else?
Fernando, I want to thank you as the representative of the International Rorschach Society. It's been a very important organization for my personal growth. I love coming to the congresses. I always have good discussions, and it's so exciting to be part of this organization. And so I just want to say how much I'm happy to be a part, and thank you for helping it continue. I think it's a very important organization. So.
Thank you so much. And thank you also for supporting and backing us. And, many of the people who come to our congresses are so interested in follow your ideas and expositions, and also those from your pupils.
Thank you. Thank you. And I'll keep dragging as many people as I can to the Congress.
Yes, please. Well, thank you so much for this time again, and thank you also for your wonderful work.
Thank you, Fernando. Thank you so much.